Good afternoon. Joe Ruffolo, the President and Chief Executive Officer of Niagara Falls Memorial Medical Center. Today I want to give a few words on what it means to be an independent hospital. So many don't realize, but Niagara Falls Memorial Medical Center is the last independent hospital in all 8 counties of Western New York. And what that basically means is that all of the rest of the hospitals are either part of the Kaleida Health System, the Catholic Health System, the UPMC, University of Pittsburgh Medical Center for those in the southern tier, and for those east, they're part of the Rochester General Health System. And what I want to share with you is the fiscal reality and also the community benefits, the substantial community benefits of being independent. Personally, I've spent most of my career in leadership capacities, building large academic health systems, merging community hospitals and consolidating hospitals into large settings. But what's equally challenging, especially the current time, is maintaining a hospital's independence, which independent hospitals in New York State and across the country are becoming more and more extinct. And the reason being is the significant mounting financial pressures from federal and state governments from continuing to ratchet down payments to hospitals for caring for the elderly, the most frail, those that are on disability, and especially those that are poverty-stricken. And caring for that type of population labels a community hospital as an essential community provider. And that's what Niagara Falls Memorial Medical Center is. It's an essential community provider. Now, what tends to occur when a community hospital becomes a part of a large healthcare conglomerate is that there are many instances, not all instances, but there are many instances where community hospitals tend to not get the attention that they truly deserve. In essence, they get lost because their voices are not heard because of their size within a larger system. And quite often they become a chain link in a very large system. And services that are duplicative of the mother system within that large conglomerate, those services that are duplicative get cut. You'll find that services that need to be expanded may not get the resource allocation that they truly deserve in that particular community. Quite often, community hospitals, as a part of a large system, their emergency room becomes more of a triage center where they continuously ship patients out of the community to receive specialized care that no longer exists. And over time, sadly, many community hospitals within the large system either close or transform to an urgent center and an outpatient center and become feeders into the much larger system that's in a separate geographic area. And frankly, it's all about economics. Economics is what makes those strategic decisions within large systems. The fiscal reality of being independent is that Niagara Falls Memorial eats what it catches. We don't catch, we don't eat. That means there's no federal or state or local subsidies that support us. There's no big brother in a large system that can back us. And as one of the largest employers in Niagara County, in a substantial workforce development site, we depend on delivering high-quality patient care to as many residents as possible to keep the ship afloat and to continue to sail through these very rough waters. So how does an independent benefit the community that we serve? First and foremost, an independent hospital like Memorial is locally owned, locally controlled, and has a local governing board. So frankly, what it means is that we determine what's best to serve the needs of our community and not some other body that's in a separate geographic area making those decisions on our behalf. It's essentially making decisions in the communities that we work and many of us live. It enables us to determine what needs aren't met and be flexible and agile to make those services readily available. So for example, we built the Golisano Community Health Center several years ago to expand primary care downtown, and equally, if not more important, to provide primary care, behavioral health, and dental services for the intellectual development and disability population, a population that has been underserved in this community for years and years. And many of them have had to travel to Erie County and beyond, some in Rochester, just for a simple primary care or behavioral health appointment, which can be quite an obstacle for these individuals, considering the transportation back and forth and the caregivers that has to go with them. Just for a simple half-hour appointment would take an all-day trip for those that could make it. It enables us to expand primary care in locations where it doesn't exist within our communities. It enables us to develop specialty services for areas where we have a void, and enables us to recruit the medical and women manpower needs that we need to provide those services right here locally. That enables us to provide these services in a much more accessible way. It deals directly head-on with reducing the health disparity issues that currently exist as a result of individuals, especially those poverty-stricken, that can't have the accessibility to get services in alternate locations. It enables us to best serve the most fragile. So think about those that are frail, that have very little transportation capabilities to get those services outside the immediate area, in essence, improving their quality of life. We determine what services and what resources should be allocated from one area to another. And because we are not strictly aligned with one large healthcare system or another, it gives us an opportunity to partner with them all. So for example, we provide cardiac catheterization services in the Niagara Heart Center. And we do that in partnership with Kaleida Health, Catholic Health, and Erie County Medical Center. So we have 4 owners of our cardiac cath lab. We developed a neonatology program for our labor and delivery service, and we've done that in partnership with Catholic Health. We've developed the endoscopic surgery center out at Summit in partnership with GI Associates and Kaleida. And coming soon, we will be opening the Golisano Medical Oncology Center, a comprehensive cancer center in a joint venture partnership with Roswell Park Comprehensive Cancer Center. So if we were merged with one system or another, all of those opportunities would not have been available to us in enabling us to provide all of those specialty services right here locally. So yes, we sort of operate like the country Switzerland, playing with everybody. So these benefits come with a huge financial price and a huge financial challenge, because we're dependent on maintaining and increasing our market within specialty services, because those specialty services help provide the resources to take care of the inner city healthcare needs, especially among those most stricken within poverty areas. And then, of course, then came COVID. And as many know, hospitals were forced to close elective surgical programs and other programs in the event that those beds would be needed for a surge of COVID activity during the months of March and April. And it paid a price. We paid a price. The toll was that we lost over $6 million in revenue as a result of the closure of these programs. And we've increased expenditures close to $2 million in preparation for COVID patients coming in and for all of the costs associated with caring for COVID patients. So in effect, over the period of March and April, we've lost over $8 million between the reduction in revenue and the increase in expenses. Now, we did receive some stimulus money from the CARE Act from the federal government, and that totaled $1.8 million. So we still have a gap of $6.2 million. I don't have the time to get into the unfairness of the distribution of the federal CARE Act money, but let me share with you that the intent of the federal stimulus money was for the funds to flow to where the COVID activity was most impacted. And in effect, the first $50 billion that was distributed, of which we received $1.8 million, because of the methodology, some of the most wealthiest healthcare systems that had billions and billions of dollars in cash reserves received the most money from that first $50 billion distribution. And the hospitals, especially the essential community providers like Niagara Falls Memorial, the ones that take care of a high portion of elderly, frail, disability, a high portion of the Medicaid population, and significant COVID activity, those community hospitals received the least amount, and those are the ones that needed the most in terms of the proportion of their budget. So the first $50 billion helped the rich, and it devastated the poor. So our survival is for our ability to maintain and enhance our financial viability is largely dependent on you, your family, loved ones, relatives, your friends, to choose Memorial. Our 1,250 employees depend on you. We're one of the largest employers in the area. We're a significant economic catalyst. So choose Memorial for your primary care needs. Choose Memorial if you need emergent needs. Go to ER1. We provide the only cardiac cath lab in partnership with the other healthcare systems in the Heart Center of Niagara. We have a neuro and orthopedic spine program that is second to none. We have expanded our sports medicine program, which includes arthroscopic orthopedic surgery and physical therapy by sports medicine and athletic trainers. We have the only multidisciplinary wound care center within Niagara County. Infectious disease program. We have full services provided for women's care. Comprehensive behavioral health care. Minimally invasive and robotic general and vascular surgery. Weight loss programs. Bariatric center. We have a new joint replacement program in partnership with the University of Buffalo Department of Orthopaedics. And as I said earlier, coming soon, we will be providing medical oncology services in the Golisano Medical Oncology Center in partnership with internationally renowned Roswell Park Comprehensive Cancer Center coming in July. So in closing, you can help us by choosing Memorial. Exceptional care, exceptionally close.